For all the details on what happened to me regarding my injury, we're pushing 100 hours plus video now. YouTube channel, My Medical Nightmare. Alright, so my issues with Dr. Perry L. Savage Sr. and OrthoAlabama Spine Sports. September 14th, 2019. Visit location 1801 Gadsden Hwy, Birmingham, Alabama 35235. Just a few feet from the Trussville city limits line. $300 cash visit. Appointment at 3 p.m. I sat in the waiting room 2 hours until I saw him. Walked out of the place near 6 p.m. Their waiting area does not offer patient-customer privacy or security. A crude half-wall Chinese screen curtain separates patients from the sign-in area, where 4 or more patients at one time give their personal details. Customers can be heard giving personal health information, which is a concern of HIPAA, HIPAA, in the general waiting area adjacent to this. In the visit with Savage, I presented images of my own head and neck, clearly showing the issues, which included several inch diameter head trauma, curiously not acknowledged by this 50-year surgeon and professional who graduated from the University of Alabama School of Medicine in 1968. Probably has seen almost every type of injury that is humanly possible. So one thing Savage told me was that the medical imagery that I showed him to assess my injury was not good enough. He wrote this in my chart. You can see it here. He says I just showed him a few slides of CT copied on paper. This is not accurate. I had a DVD-ROM disc that Dr. Savage put into his computer in the examination room. We both looked through imagery. I pointed to the same area in these pictures where anomalies have been noted. And again, he told me with a straight face that those were not injuries. My pictures looked normal. And I'll show some new findings as of April 2026. Interestingly, the same CT scans that I shared with him that he said weren't good enough have been newly assessed to be a high-resolution bone algorithm slice appropriate for evaluating osseous bone integrity. I had a chance to put this imagery in front of some new experts and compare this new information to the few lines of text Savage wrote in my chart. Alright, so the area we're looking at, an axial view of the craniovertebral junction, specifically focusing on the base of the skull and the first cervical vertebrae, C1, the atlas. Primary findings. Within the highlighted red region, patient's left side image right, there's a significant disruption in the cortical continuity of the C1 lateral mass and posterior arch. This appearance may suggest a comminuted fracture where the bone breaks into several fragments. The bone in this area appears irregular and displaced when compared to the contralateral side, that's the patient's right. These findings could reflect an acute traumatic injury to the atlas, such as a Jefferson-type burst fracture or a complex lateral mass fracture. And continuing examination details comparison. When comparing the highlighted region to the opposite side of the image, the normal ring-like structure of the C1 vertebrae is lost. The contralateral patient's right side shows a more continuous and expected cortical outline. Anatomical deviation. The fragments in the red box appear to be shifted, which could indicate instability at the craniovertebral junction. The findings are highly consistent with an acute fracture of the C1 vertebra atlas on the patient's left side. Because injuries to the upper cervical spine carry a high risk of instability and potential neurological complications, this requires immediate evaluation by a neurosurgeon or orthopedic spine specialist and usually necessitates stabilization, such as a cervical collar, until fully cleared. I mentioned in the other video where, after challenging the Birmingham Radiological Group, Ascension, and UAB doctors, I was retaliated against, and the future healthcare providers that I went to, when they looked into my case, some protest was made from one of the earlier providers, and all of a sudden I found doors were being closed to me in my quest for diagnosis and treatment of this injury, which I was repeatedly told did not exist. To OrthoAlabama and Dr. Perry Savage, they apparently had a working relationship or partnership with the Birmingham Radiological Group doctors, UAB, St. Vincent's, and Ascension. In the chart note where Savage claims he cannot explain my pain, but refers me on to their partners, University of Alabama at Birmingham, UAB. I did another video where OrthoAlabama and their doctor Malampati were the subject of a civil lawsuit in which Birmingham Radiological Group Dr. Julian Patrick Druhan was blamed for contributing to a patient's death days before that individual had some medical imagery done and was accused of not spotting deep vein thrombosis, which may have been a causative factor in that patient's death. Physician assistant Ben Jeter, PAC, sat in during this exam. He entered the room and never introduced himself. Dr. Savage also never introduced him to me as well, and this is not professional. When Savage was not looking at my CT, X-ray, and MRI images, Jeter thumbed through my files. Mr. Jeter silently observed. When I left, this man told me someone in their office would call me about a UAB neurosurgery referral in a few days' time. Why was I referred to a neurologist if the doctor claimed I had no injury? This phone call never took place. After 1 week, I had to call OrthoAlabama myself and found the appointment had indeed been made. Again, I was not informed. And what's more, I was put on a 3-month waiting list for the referral to UAB. Dr. Mina Lubos, I was called by UAB and told I would have to wait an additional month because they were moving to Gardendale. At this point, I told UAB to forget it, and I canceled. I tried to contact OrthoAlabama and Dr. Savage later. When I found out the true extent of my injuries, I told an office representative I did not believe I received fair service for my money. I invited Dr. Savage to call me and discuss this. A telephone call was recorded. You can hear it in my videos. The OrthoAlabama receptionists play the usual out-of-office games, despite the fact I got a call from the office manager just a few minutes before. That call that I was promised then and there was not returned either. I was referred to Dr. Savage in OrthoAlabama from a previous visit at AFC American Family Care, $175 cash, located off of Parkway East near Roebuck. American Family Care would not back me up on getting this write-off of a medical exam corrected. I later learned AFC is corrupt and not a reputable practice, and anyone who takes business from them is immediately suspect.